we will jump to the last part of our event today. Mamdouh, are you ready with the quiz answer?
Yes. Okay, so I will send the link again if anyone wants to take the quiz, and I will share my screen and tell everyone the correct answer. I think we have a very good percentage of correct answers even before the
Good
course.
news.
Sorry?
This is after the presentations or
No, it's
before the
just
presentation,
before
Mamdouh?
the presentation. So I think
Good
we
news.
have yeah, a very good experience in the audience even before. So I will start reading the question. If anyone wants to take the quiz, I think he can just click on the link. I just put it into the chat. So the first question is, which of the following represent a prominent histopathological abnormality in primary FSGS? Endocapillary proliferation, immune complex deposition, food process effacement, and crescent formation. And we have about 82% of patients, 82% of candidates, they choose food process effacement, and this is the correct answer.
Good.
Second question, which of the following is the best prognostic sign for FSGS progression? Circulating levels of permeability factors, histopathological light microscopic pattern at diagnosis, the degree of proteinuria at presentation, or initial treatment responsiveness in proteinuria control. We have about 64% of attendees, they choose initial treatment responsiveness in proteinuria control, and this is the correct answer. Third question, which of the following FSGS light microscopic pattern is the most reported with COVID-19? Tib, collapsing, prehilar, or not otherwise specific. And we have 55% of attendee, they choose collapsing FSGS. And this is the correct answer. Fourth question, which of the following raises the suspicion of secondary cause for FSGS? Typically presents with nephrotic syndrome, diffuse food process effacement, insidious disease onset, recurrence after kidney transplantation. For the fourth question, 82% they choose insidious disease onset, and this is the correct answer. The fifth question, which of the following drug is a second-line treatment in steroid-resistant FSGS? Calcineurin inhibitor, rituximab, methotrexate, cyclophosphamide, and we have 82% they choose calcineurin inhibitors. This is the correct answer. 14 weeks pregnant lady presented with 2 weeks history of leg swelling and 24-hour urinary protein 3.6 gram. The most likely diagnosis is eclampsia, pre-eclampsia, FSGS, or post-streptococcal glomerulonephritis. We have about 91% they choose FSGS. This is the correct answer. Pre-eclampsia can be diagnosed after 20 weeks of gestation if the onset blood pressure is equal or more than 140/90. So the patient had hypertension with platelet count of 90,000 without proteinuria, or proteinuria 4 grams per day without hypertension, or renal impairment with proteinuria and normal blood pressure, or platelet count less than 100,000 without other manifestation. And we have 73% of attendees choose new onset hypertension with thrombocytopenia without proteinuria, and this is the correct answer. Last question is, which one of the following immune suppressive drugs can be used cautiously in pregnancy? Cyclosporin, cyclophosphamide, MMF, or chlorambucil? And we have 82% choose cyclosporin, and this is correct answer. So this was the last question. If any of the attendees has any other question, you can write it in the chat box. And I think that by the end of the second day, all attendees should receive like a link for assessment of the course. Thank you.
Okay, Mamdouh. Good news that most of the attendee actually they chosen the right answer. So we really enjoyed this more than 2.5 hours of this interesting course. We have enjoyed 2 presentations by 2 eminent speakers. The first one, Professor Abdallah Al-Jira. We really enjoyed his eminent presentation, which is podocytopathy. Also, we enjoyed the presentation of Dr. Ahmed Magdi about Fsgs. We really enjoyed the the case presentation by my colleagues Shirou Nagar, Mahmoud Naguib, Dalia Younis, and the last presentation by my colleague Ahmed El Said. Actually, this event have never happened without the tremendous efforts of many of the hidden heroes. We thank all of them from the states, my colleague Professor Amr Al-Husseini, Professor Abdallah Al-Jira, Professor Peter Sohair, and also from Mansour, the hidden heroes, my colleague Mustafa Abdsalam, Mamdouh, Ahmed Magdi, Shirou, Nihal, Mahmoud Naguib, Mahmoud Sabh. They actually spent more than 2 months to organize and to coordinate for this fascinating meeting. Thanks to everyone, the speakers, thanks for the attendees, thanks for everyone who came today and attended actually this fascinating event. And at the end, I would take the chance to congratulate all of you